Cancer, a word that strikes fear into the hearts of many, is one of the most formidable diseases known to humanity. It represents a group of diseases characterized by the uncontrolled growth and spread of abnormal cells. If not detected and treated early, cancer can invade nearby tissues and spread to other parts of the body, a process known as metastasis. It also has a deadly influence on the cells of the large intestines and keeps things from getting out where they naturally should. Despite significant advancements in medical science, cancer remains a leading cause of death worldwide, affecting millions of lives each year. Understanding the nature of cancer, its causes, and how to minimize the risks associated with it is crucial for safeguarding one's health and the health of loved ones. So, and at its core, cancer is a disease of the cells. The human body is composed of trillions of cells, each with a specific function and life cycle. Under normal circumstances, cells grow, divide, and die in a controlled manner. However, when this process goes awry, due to genetic mutations or environmental factors, cells may begin to grow uncontrollably, forming a mass known as a tumor. Not all tumors are cancerous. Benign tumors do not spread to other parts of the body and are usually not life-threatening. Malignant tumors, on the other hand, can invade surrounding tissues and pose a serious health threat. One of the most challenging aspects of cancer is its complexity. There are more than 100 types of cancer, each with its own characteristics and behavior. Some of the most common types include lung cancer, breast cancer, prostate cancer, colorectal cancer, and skin cancer. Each type can manifest differently with varying symptoms, treatment options, and prognoses. So prognoses, I use that word very loosely. I should have said prognostics and prognometry. This diversity makes it difficult to generalize about cancer, emphasizing the importance of personalized medical care and attention. The causes of cancer are multifaceted, involving a combination of genetic, environmental, and lifestyle factors. Genetic predisposition plays a significant role in some cases, as certain inherited mutations can increase an individual's risk of developing specific types of cancer. For example, mutations in the BRCA2 and BRCA2 genes are strongly associated with an increased risk of breast and ovarian cancer. However, it is important to note that genetic factors alone are rarely the sole cause of cancer. Environmental and lifestyle factors often interact with genetic predispositions to influence cancer risk. Environmental factors, such as exposure to carcinogens, significantly contribute to the development of cancer. Carcinogens are substances or agents that can cause cancer by damaging DNA or disrupting normal cellular processes. Common examples include tobacco smoke, ultraviolet, UV, radiation, certain chemicals, and even some viruses and bacteria. Prolonged exposure to these agents can increase the likelihood of genetic mutations, setting the stage for cancer to develop. The lifestyle choices also play a pivotal role in cancer prevention and risk management. Tobacco use is the leading cause of preventable cancer deaths, accounting for a significant percentage of lung cancer cases as well as cancers of the mouth, throat, pancreas, and bladder. Similarly, excessive alcohol consumption is linked to cancers of the liver, breast, and digestive tract. Poor dietary habits, lack of physical activity, and obesity further compound the risk as they contribute to inflammation, hormonal imbalances, and other metabolic disruptions that can promote cancer development. One of the most insidious aspects of cancer is its ability to remain undetected in its early stages. Many types of cancer do not cause noticeable symptoms until they have progressed significantly, making early detection a critical component of effective treatment. Regular screenings and self-examinations can play a vital role in identifying cancer at an early stage when it is most treatable. For instance, mammograms can detect breast cancer, pap smears can identify cervical cancer, and colonoscopies can reveal colorectal cancer. Awareness of family medical history and discussions with healthcare providers can further guide individuals toward appropriate screening measures. While the prospect of developing cancer can be frightening, there are numerous steps individuals can take to reduce their risk and protect their health. Adopting a healthy lifestyle is one of the most effective ways to minimize cancer risk. This includes maintaining a balanced diet rich in fruits, vegetables, whole grains, and lean proteins while limiting the intake of processed foods, red meats, and sugary beverages. Antioxidant-rich foods, such as berries, nuts, and leafy greens, can help combat oxidative stress and reduce cellular damage, thereby lowering the risk of cancer. Regular physical activity is another cornerstone of cancer prevention. Exercise helps regulate body weight, improve immune function, and reduce inflammation, all of which contribute to a lower risk of cancer. Engaging in moderate intensity activities, such as brisk walking, swimming, or cycling, for at least 150 minutes per week can provide substantial health benefits. For those with sedentary lifestyles, even small changes such as taking the stairs instead of the elevator or walking short distances instead of driving can make a difference. Avoiding harmful substances and environmental exposures is equally important. Quitting smoking is perhaps the single most impactful action a person can take to reduce their cancer risk. For non-smokers, avoiding secondhand smoke is also crucial. Protecting the skin from excessive UV radiation by wearing sunscreen, seeking shade, and avoiding tanning beds can prevent skin cancer, the most common type of cancer worldwide. Additionally, using protective equipment and following safety guidelines in workplaces that involve exposure to hazardous chemicals can help minimize risks. Vaccination is another powerful tool in cancer prevention. Certain viruses, such as human papillomavirus, such as HPV and hepatitis B, are known to increase the risk of cancers like cervical, liver, and throat cancer. Vaccines against these viruses are widely available and have been shown to be highly effective in reducing cancer incidence. Encouraging widespread vaccination, especially among adolescents and young adults, is a critical step toward reducing the global burden of cancer. Early detection and timely medical intervention can significantly improve the outcomes for individuals diagnosed with cancer. Advances in diagnostic techniques such as imaging technologies, biopsy methods, and molecular testing have made it possible to identify cancer more accurately and at earlier stages. In recent years, the emergence of liquid biopsies, a non-invasive method of detecting cancer through blood samples, has shown great promise for early detection and monitoring. These advancements enable healthcare providers to tailor treatment plans to the specific needs of each patient, improving the chances of successful outcomes. Treatment options for cancer vary depending on the type, stage, and individual characteristics of the disease. Surgery, radiation therapy, chemotherapy, and targeted therapies are among the most common approaches. In recent years, immunotherapy, a treatment that harnesses the body's immune system to fight cancer, has emerged as a groundbreaking development in oncology. Immunotherapy has shown remarkable success in treating certain types of cancer, such as melanoma and lung cancer, and continues to be a focus of extensive research and innovation. Supportive care is an integral part of the cancer journey, both for patients and their families. The physical, emotional, and psychological toll of cancer can be overwhelming, making access to counseling, support groups, and palliative care essential. Open communication with healthcare providers, family members, and friends can help individuals navigate the challenges of cancer treatment and recovery. For caregivers, understanding the importance of self-care and seeking support can ensure they remain resilient while providing the best possible care to their loved ones. Research and innovation in cancer prevention, detection, and treatment continue to offer hope for a future where cancer is no longer a leading cause of death. The development of precision medicine, which uses genetic and molecular information to tailor treatments to individual patients, represents a significant leap forward in oncology. Similarly, advancements in artificial intelligence and machine learning are enhancing the ability to analyze medical data, predict outcomes, and identify new therapeutic targets. These breakthroughs have the potential to transform the way cancer is understood and managed, improving survival rates and quality of life for patients worldwide. Public awareness and education are critical components of the fight against cancer. Misconceptions and stigma surrounding the disease can create barriers to early detection, treatment, and support. By fostering open conversations about cancer, promoting preventive measures, and highlighting the importance of regular screenings, communities can empower individuals to take control of their health. Initiatives that prioritize equitable access to healthcare, particularly for underserved populations, are essential for reducing disparities in cancer outcomes. The role of governments, healthcare organizations, and nonprofit agencies in combating cancer cannot be overstated. Policies that regulate tobacco use, promote healthy diets, and encourage physical activity can create environments that support cancer prevention. Funding for cancer research and access to affordable healthcare services are vital for advancing the fight against cancer. This last one is the most important, right? Because it takes time to combat cancer, right? Collaborative efforts on a global scale, such as the World Health Organization's Global Action Plan for the Prevention and Control of Non-Communicable Diseases, exemplify the collective commitment needed to address this pressing public health challenge. Cancer remains one of the scariest diseases in humans due to its complexity, unpredictability, and potential for devastating consequences. However, it is not an insurmountable foe. By understanding the causes and risk factors associated with cancer, adopting preventive measures, and seeking timely medical care, individuals can significantly reduce their likelihood of developing the disease. Advances in medical science, coupled with increased public awareness and collaborative efforts, continue to pave the way for a future where cancer is no longer a source of fear, but a challenge that humanity has successfully overcome. Through vigilance, education, and action, we can protect ourselves and our loved ones from the scariest disease in humans,